My name is Shonda, and we are Team E. Today we will be discussing mental health in regards to mental illness. Just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in a diminished capacity for coping with ordinary demands of life. While there's still variations within the medical community regarding the definition, assessment, and classification of medical illnesses, most doctors would agree that the disorders can be classified into two categories: common and uncommon. Mental illnesses consist of bipolar disorders, depression, schizophrenia, addiction, obsessive compulsive disorder, post traumatic stress disorder, as well as generalized anxiety disorder and phobias, to mention a few. Approximately 450 million cases of mental illness exist worldwide. An estimated 26.2% of Americans, which is about 1 in 4 adults, suffer from a diagnosable mental disorder a year. Mental illness costs the United States an estimated $150 billion annually, and this is excluding the cost of research. The effects of mental illness are evident across the lifespan, among all ethnic, racial, and cultural groups, and amongst persons of every socioeconomic level. One theory says that mental illnesses and suicides can be linked to the altitudes, a pattern seen in mountain states. Throughout this presentation, we will explore why mental illness has an effect on the adults in the state of Utah. We will also examine some statistics related to mental illness in Utah and some of the risk factors that contribute to this ongoing problem. Utah has the nation's highest rate of mental illness. The theory places Utah in a wider context of Rocky Mountain states, which generally see the same pattern: a high mental illness and suicide, but otherwise healthy residents. The region is sometimes called the suicide belt, and the theory is that the diminished oxygen at high altitudes may affect brain chemistry in a detrimental way for those prone to depression, bipolar, and schizophrenia. There's also indication that some medicines don't work as well in high altitudes. In addition to high altitude, psychiatrists point to several other factors that could contribute to Utah's high level of depression, which consists of limited mental health resources, restricted access to treatment as a result of cost, poor quality of resources, and a varied list of other factors, which also include an underfunded educational system and a culture deeply rooted in the Mormon faith. Now that we've examined some of the possible reasons as to why Utah ranks amongst the highest on the list, let's next examine some important statistics for the state. According to preliminary data from the Office of Vital Records and Statistics, 495 Utahns took their own lives in 2011, compared with 455 in 2010, and in 2012 an average of 501 Utahns died from suicide, and that's based on the Utah Department of Health. Overall, more Utahns are hospitalized or treated in an emergency department due to suicide attempt than those who are fatally injured. Use of firearm is the most common method of suicide death for Utahns, followed by suffocation and then poisoning. In addition, about 22.4 of the adult population in Utah experienced a mental disorder in the past year, according to recently released statistics. And out of those people, 5.4% had a severe mental disorder that interfered with their daily activities. Let's now examine some of the risk and vulnerabilities among persons with mental disorders. Although the exact cause of most mental illnesses is unknown, it is becoming clear through research that many of these conditions are caused by a combination of genetic, biological, psychological, and environmental factors. It is important to mention mental illness is not a personal weakness or a character defect, and recovery from a mental illness is not simply a matter of will and self discipline. Risks to mental health include family violence or conflict, negative life events, and a low sense of connection to schools or other learning environments. At their worst, exposure to risks such as persistent beatings, severe bullying, parental loss, or abuse can cause a level of trauma that has an indelible effect over the course of one's life. Mental health and well being is influenced not only by individual attributes, but also by the social circumstances in which a person finds themselves and the environment in which they live. These detriments interact with each other dynamically and may threaten or protect an individual's mental health. Mental illnesses can influence the onset, progression, and outcome of other illnesses and often correlates with health risk behaviors such as substance abuse, tobacco use, and physical inactivity. Depression has emerged as a risk factor for such chronic illnesses as hypertension, cardiovascular disease, and diabetes, and can adversely affect the course and management of these conditions. Let's also not to forget to mention that individuals who live with a mental disorder have an increased likelihood of experiencing disability and premature mortality, stigma and discrimination, social exclusion, and impoverishment. Another important area we must examine is how the two essential services that revolve around assessment, which are the monitoring and diagnosis and investigation of health, are applied to this health problem. The CDC has mobilized multiple efforts to assess and address mental health and well being. Data on mental health, risk behaviors, and comorbidity of mental illnesses and chronic diseases are collected through various national surveillance initiatives. Surveillance for a particular condition might depend either on collection of new data or use of data obtained from existing health information system, which is often obtained from vital statistics or public health surveys. Surveillance data are essential to the public health goals of reducing the incidence, prevalence, severity, and economic impact of mental illnesses. Public health officials, academicians, healthcare providers, and advocacy groups need accurate and timely information on the prevalence and effect of mental illness to detect and characterize trends in mental illness prevalence and severity. Now that we have explained how the two essential services revolve around assessment are applied to this health condition, let's explore what's been done in general to address the issue of mental illness. In order to overcome the barriers of closing the gap between resources and the need for treatment of mental disorders, and to reduce the number of years lived with disability and deaths associated with such disorders, the World Health Organization, also known as WHO, has created the Mental Health Global Action Program as part of a major effort to implement the recommendations mentioned in the World Health Report 2001 on mental health. The program is based on strategies aimed at improving the mental health population. The World Health Organization has developed guidelines for mental health interventions in emergencies and for the management of depression, schizophrenia, alcohol related disorders, drug use, epilepsy, and other neurological disorders. The Mental Health Global Program has four core strategies: advocacy, information, policy, and research are the key factors underlying WHO's new global mental health program, which aims at closing the gap between those who receive care and those who do not. Considering Utah ranks amongst the nation's highest in mental illness, there are several community resource programs available to address these issues, such as the National Alliance on Mental Illness in Utah, which is also referred to as NAMI, Utah Support Advocates for Recovery Awareness, also called USARA, Parents Empowered, Allies with Families, New Frontiers for Families, Utah Parent Center, Utah State Hospital Substance Abuse and Mental Health Service Administration, which is also known as SAMHSA, and mentalhealth.gov, and that's just to mention a few. Let's now look into a few initiatives that currently exist to improve the lives of the mentally ill. Mental Health America, originally founded by Clifford Beards in 1909 as the National Committee for Mental Hygiene, worked to improve the lives of the mentally ill in the United States through research and lobbying efforts. A number of governmental initiatives have also helped improve the U.S. mental health care system. In 1946, Harry Truman passed the National Mental Health Act, which created the National Institute of Mental Health and allocated government funds towards research into the cause of and treatments for mental illness. In 1963, Congress passed the Mental Retardation Facilities and Community Health Centers Construction Act, which provided federal funding for the development of community-based mental health services. The National Alliance for the Mentally Ill was founded in 1979 to provide support, education, advocacy, and research services for people with serious psychiatric illnesses. Other government interventions and programs, including social welfare programs, have worked to improve mental health care access. While most people with a mental illness can manage reasonably within the context of our larger healthcare system, those with chronic conditions require central public policy attention. If we are to give people with depression, bipolar disorder, and chronic mental illness in general a reasonable chance for adequate treatment, attention needs to be given to some new policy reforms or public policy reforms. Mental health policies and plans are essential tools for the coordinating of all mental health services. Without such coordination, mental disorders are likely to be treated in an insufficient and fragmented manner. Policies are more likely to achieve the desired effect when they reflect a clear commitment from governments. Such policies should be designed to improve the care of and reduce the burden on those individuals with mental health, neurological, and substance use and abuse disorders. In addition, there is an urgent need for adequate health insurance for both physical and mental illnesses to be made available to all people at a price they can afford. The system should provide all needed services for all mental illnesses and conditions ranging from diagnosis, talk therapy, medication, to hospitalization if necessary, in addition to the policies that need to be developed around providing adequate supervision and direction to our public mental health system at a local, county, and state levels. Now that we have mentioned a few policies that should be developed, let's look at those who should be present during the developmental stages. Stakeholders from relevant departments, institutions, and civil society should be identified and invited to such consultations. These participants must be selected based on their level of expertise and experience, consisting of psychiatrists, psychiatric social workers, psychologists, public health specialists, public analysts, program managers, human resource development experts, human rights activists, and public service providers to make sure all areas of mental health are covered when developing policies. Let's now discuss how the three essential services are applied to mental illness. People living with mental illnesses need help and hope. They need a community that supports them, their families, and their recovery process. Since mental illness devastates the lives of so many Americans, NAMI works every day to save every life. NAMI is the National Alliance on Mental Illness, the nation's largest grassroots mental health organization dedicated to building better lives for millions of Americans affected by mental illness. NAMI advocates for access to services, treatment, supports, and research and is steadfast in its commitment to raise awareness and build a community of hope for all of those in need. NAMI is the foundation for hundreds of NAMI state organizations, NAMI affiliates, and volunteer leaders who work in local communities across the country to raise awareness and provide essentially free education, advocacy, and support group programs. Public awareness events and activities including Mental Illness Awareness Week, NAMI Walks, and other efforts successfully combat stigma, promote awareness, and encourage understanding. Government authority, whether at a federal, state, or local level, needs to be able to enforce public health laws, regulations, and ordinances. The CDC, the Center for Disease Control, would be considered a federal health authority, while the State Department of Health would be a state authority, and a local city or county department of health would be the local authorities. The health departments may work in conjunction with other government agencies, including police. In order to enforce these laws, regulations, the legislative branches of the government need to assure each government entity is empowered through law to act in public health emergencies and carry through any necessary interventions. The health departments are responsible to educate and inform the individuals affected by these laws, as well as the compliance with the regulations and laws. The referral mechanism is the consistent link between one agency and another. Under Utah law, the local substance abuse and mental health authorities are responsible for providing services to their residents. A local authority is generally the governing body of a county. There are 29 counties in Utah and 134 local authorities. Some counties have joined together to provide services for their residents. By legislative intent, no substance abuse or community mental health center is operated by the state. Some local authorities contract with community substance abuse centers and mental health centers, which provide comprehensive substance abuse and mental health services. Patients with mental illnesses have initial contact with either the police or emergency services. These organizations make the referral to primary care, social services, and mental health systems to facilitate access to personal health services. A portion of the link to services is provided on a social service level, which assists in the enrollment process into the state Medicaid or medical and prescription assistant programs. This helps ensure its payment for provided services. The task of assuring a competent workforce is multifaceted. The first portion, which has many levels, is actually the assurance of skill level in education. Training programs are implemented on a federal, state, and local level to assure the same level of knowledge is attained. The actual competency is set up by Medicare and Medicaid regulations if they are the primary paying source. Private insurances often put clauses in their contracts that state care workforce must meet the competency level required by Medicare and Medicaid regulations. The actual size of the workforce is vague. The regulations often state that there should be as much staff needed to provide safe and effective care. The determination of safe and effective care is done in the Department of Health survey process. During this survey, which would be an unannounced visit by an auditor, that auditor would evaluate for expected adherence to regulations. In the event that adherence was not met, it may be determined that additional staff is needed. In Utah, the R156-60-101 is an example of legislation that outlines the definition and expectations of mental health for the state. This rule is also known as the Mental Health Professional Practice Rule. Health departments and community health providers participate in research that contributes to the evaluation of health policy, analysis, and improve health system performance. The health department works with local providers to gather information pertaining to the epidemiology, policy, and health systems. The research begins with researchers who have knowledge and skills to design and conduct research in those areas. They also have the availability of resources such as a technical library and online services. Once the research is done, the findings are then disseminated via public health networks such as listservs, emails, journals, and public or private websites. We are the E-Team, and this is our presentation thus far. This is our reference page, and we thank you for your time. Stay tuned for our final presentation.